which create, because you are supposed to only report if you can detect visible fiber of longer than 10 micron. And in the water, longer than 10 micron, it's because of the size and weight. Usually in drinking water, only small particles come in. So even you have a lot of the asbestos, if the size is less than 1 micron, there's no way. So we send one of the most well-known laboratory in New York, and not only send, but I went special permission, step by step. We checked where the error is made, and we found out this regulation is the one, automatically eliminating.
Yeah.
So.
And so the sad thing is that many people, they filter their water and they can actually add asbestos. So often, even these over-the-counter, under-the-counter, handheld devices or shower filters can make the water actually worse than the city water.
In fact, recently we had a few cases where filtered water has more asbestos.
Exactly.
And the original one don't even have asbestos.
Are there any filters that are good?
Well, individually we have to test, yeah.
That's the unfortunate thing, is you have to test individually because you don't know. And that's the conclusion we have with many things you'll find this weekend.
And also another important thing in asbestos, every Alzheimer's disease and every autism patient's brain, there is an increase in asbestos. And they have about 7 different asbestos, but the one I'm talking is one called the chrysotile asbestos, and that's generally known as a white asbestos. Chrysotile.
Is that the most toxic or most common?
Most common. And there is another one that is the most toxic one called Telomeres asbestos. When you have that, in addition to chrysotile, cancer becomes most malignant.
Dr. Omura,
Yes.
for those of us that already have water that is asbestos in our homes, or our homes already full of asbestos, what do you recommend for us, since we can't fill our homes, get rid of our water utility company, et cetera, et cetera? What can we do? Is there anything we do to save ourselves?
Well, unless you check and if you find you don't use it.
But if it's in our house, it's in our walls.
Well, which part of the house?
Well, he's not saying every house is like this. You have to check house by house.
Well, we know it's in our house.
Oh, you know it's in your house. Okay.
Then bring your picture of your house, inside the wall. I can test. You live around here?
Corona.
I don't know where the corona is.
It's half an hour from Irvine.
Okay, then tomorrow bring picture of your, ceiling and wall. I can test. Or if you have a sample of the wall or ceiling, it's even better.
Will steam distillation remove the asbestos?
What?
No, it will not distill because it does not distill. Distillation, distilled water does not filter out.
No, absolutely not.
Dr. Murphy?
Yes?
Since we brought the subject up to those who are new, are you going to go into discussions about how to work with the removal of asbestos?
Yeah. Well, before I forget, maybe I can give you that answer. if you check on any medical book, they say once asbestos is accumulated in the body, you have to remove it surgically. But we can remove most of them without any surgery. And we found two methods. One is you use cilantro tablet. Cilantro is it's a long story about cilantro. I discovered how we discovered, yeah. And the other one is
now, when he says cilantro, it's not just any cilantro off the shelf that you can find in stores, but it's a very special preparation of cilantro that Dr. Omura spent a lot of time to discover the active ingredient. So it's not just cilantro in general.
And other method is by increasing a normal cell telomere over 500 BDORT unit. Now, I mentioned that the BDORT unit, I will use this term all the time. The reason is this is not the standard chemical laboratory measurement. So whenever you use certain measurement amount, you have to give the unit. And the unit is a BDORT unit. That indicates it is measured using electromagnetic resonance phenomena of two identical substances. And when you increase normal cell telomere to over 500 nanogram, not only asbestos, but mercury, aluminum, and all the bacteria, virus, fungus, many of these things are excreted in urine without even using any antibiotics or antiviral agent or antifungal agent. So we use often these two combinations.
This is really Dr. Omura's unbelievable discovery that by increasing normal telomeres in the human body, normal cells, automatically it will do the function of improving your health and removes the toxins, removes the infection, and therefore reduces inflammation to a very minimal level. And it arrests cancer temporarily.
Yes.
That was really big, okay? Because I have books that say we need to kill all the telomeres to kill the cancer cell telomeres. There's a whole thesis about this. And then replace all your organs as we get the ability to regrow. And it's false. Chemotherapy? It does ruin telomeres. But yeah, okay. Go ahead.
Well, chemotherapy, most of them not only reduce cancer cell telomere, but also reduce normal cell telomere.
Exactly.
We are talking about, when I say telomere, we have to separate two types of telomere. The molecular structure is identical, but when there is a cancer cell telomere is always very high. And normal cell telomere, when you cell divide, each time cell divide, amount of the remaining telomere become less. And so like when you are born, telomere is the amount of the telomere at the both end of chromosome is the highest. So the newborn baby has the highest telomere, usually somewhere between 1500 to 1800 nanogram BDORT unit. I'll write down this unit B.
The BDORT unit means that it was measured based on resonance with the bidigital O-ring test technique, not a laboratory test.
Dr. Omura,
Yeah.
is the cancer telomere and a normal cell telomere the same molecular structure?
Same molecule, except, cancer cell, there is always telomere is very high. So many people speculate that there is a special enzyme called telomerase exists in the cancer cell. So many companies
Are you saying that's a speculation?
Well, that's what the people believe.
What they haven't proved?
Well, believing is not always proving.
Well, I know that.
Yeah.
They have not isolated the enzyme? Because most books talk about telomerase as the main thing.
Yeah, but, that's the concept.
Okay.
And, so far it makes sense,
Yeah, sure.
but not necessarily convince me completely, yeah. So anyway, they try to, develop the molecule which inhibit telomerase.
Yes. Does telomerase cause the cells to divide more rapidly, or is that the length of the telomere?
No, telomerase simply produce more telomere in the cancer tissue. And the cancer tissue, the cancer cell telomere is always very high. And whenever there is a cancer in any part of the body, normal cell telomere is practically zero. So that's why when I see telomere is normal cell telomere, I measure, and if it is very low, first things I try to rule out is the presence of any malignancy. And these things are not known among the researchers in telomere because, it takes so long time, to measure one telomere. And so for them to take 10 years, I can do in 1 hour. So you can see that, still many people have a, concept that telomere is relatively, fixed. It's absolutely changing every moment to moment. And not only that, we now start also measuring, in addition to telomere, so that when I say telomere, you have to, you have to identify what telomere you are talking about, normal cell telomere or cancer cell telomere. And then we recently discovered there was some molecule which is known as a longevity gene. Do you know anything about the longevity gene? We were able to get this longevity gene in pure form, and we are now able to measure this. And this longevity gene, my longevity gene is anywhere between 100 picogram to 120 picogram. And if I examine all of you, probably your longevity gene is less than 10 picogram. And I measured some of the, I will give you some example. President of the United States, his longevity gene is 0.5 picogram. What?
Oh my God!
And
If he dies fast,
and
there's good hope.
and the Prime Minister of England, I checked yesterday on the television. We can check either the handwriting or picture. We can measure. It's about same value, and he has also about 0.5 picogram, and also we found when this longevity gene is less than 5 nanogram, often they have a malignancy or infection, strong infection, and or Alzheimer's disease. And so yeah, last month I was teaching in Japan. We examined 50 doctors and dentists, and I think 80% has less than 5 nanogram and 5 picogram. And also, I can give you the typical example who has the largest longevity gene. What is his name? I forgot.
Anderson Cooper.
Yeah, Anderson Cooper.
CNN.
CNN. He has a 120 picogram, same as mine. And
Why?
why
is he so high?
Well, we are finding out those who are very healthy and mentally very active and physically active, and they seem to have that, probably partly hereditary.
Yeah.
Yeah.
It's a gene.
Yeah. And it exists in the chromosome number 10 in the P segment of the chromosome number 10 we found. And in general, we found the woman has a more longevity gene than the man. So they have some advantage being a woman.
Discrimination?
Huh?
Discrimination?
Well, I don't know what you call it. So in other words, when you have this longevity gene is less than 5 or 10 picogram, first things you have to suspect is rule out is a malignancy. Then next things to rule out is infection. And third things is some toxic substance. Yes?
So if you get the toxins out and the malignancies out, then are you able to increase the picogram numbers of the longevity?
Yeah, we can, if it is reduced due to these either like electromagnetic field or cancer or strong infection or some toxic substance you are putting or drinking. If the original gene is higher, then they will go back to the original gene. But there seems to be certain general value determined by heredity, plus environmental factors. Again, if you are interested, we can measure either telomere or longevity gene. And if it's low, there is always reason. And you have to check one by one what is causing this low longevity gene. And we identified it only exists chromosome number 10 and on the P segment, near the tip of the P segment. In other words, next to this telomere is number 10, chromosome number 10. Next to this telomere is the longevity gene. But in order to longevity gene to be active, you have to activate, but there are many factors that inhibit this longevity gene's activity.
Is it the same factors that inhibit telomeres?
More or less, yeah.
Okay.
So it's not really proportional, you know. Longevity gene is a more hereditary factor is dominant, yeah. So the ideally you have to check both of them. And also, you know, even somebody has a malignancy, some people don't have any symptom. And these we recently discovered. And this one, we found, I don't know how many people are familiar this molecule, 8-hydroxy deoxyGuanosine. How many people are familiar? Can you raise your hand, those who are familiar with 8-hydroxy deoxyGuanosine? Okay, tell me, what do you know?
I think it's an aging marker, a genetic aging marker.
No. What do you mean more specifically?
When the when there's aging from mutations.
Well, 8-hydroxydeoxyguanosine is in the presence of DNA mutation, it increases. In order to have a malignancy, you have to have a DNA mutation first. And DNA mutation, also malignancy to be active, DNA mutation value must be high. We found, you know, some just a few days ago, we had about Dr. Paulo's assistant son, who had maybe you can explain what happened to that boy. Yeah.
From the beginning, you mean?
Yeah, yeah.
Okay. And his name is Cameron. He was 14, and he had such incredible headaches. He would pass out, and on two occasions he stopped breathing, and they had to get emergency support. And so she asked if we could go to New York and see Dr. Omura. I said, of course. So we went, and Dr. Omura found an anaplastic astrocytoma in the brain tumor. It's a tumor in the brain, and it can be aggressive. And treated him that weekend, 3 days, just the way we have 3 days here. And Cameron never had another headache. It was unbelievable for us.
For the past how many years? 5 years?
Now it's been 5 years, and Dr. Omura saw him a couple days ago. He's now on his way to the university to study criminal justice.
But the program was, when I examined, still he had anaplastic astrocytoma.
He still has it.
Yeah, and he has no symptom, no headache. So we started checking all the factors. we found out this 8-hydroxy deoxyguanosine is normal value.
Which is what?
Which is 1 nanogram or less. And those who have a symptom, their value is very high. And then we found a few other cases like that. The tumor is still there, and there's not much changes, but no more symptom after my treatment. And only difference we found is 8-hydroxydeoxyguanosine is normal value.
So is it kind of like scar tissue now? Would you?
Well, I cannot tell you because I have not opened the head.
Yeah.
So I can, everything is indirect, with the measurement. That much we figured out. So this measurement is very important.
So the 8-hydroxy should correlate as you treat. That should come down, and their cancer telomeres should come down at the same time.
Yes, yeah, that would be ideal. Yeah.
Along with heavy metals, asbestos.
Yes.
Dr. Omura, does that explain why so many people go through normal chemotherapeutic modalities, stabilize, and then all of a sudden it reactivates? Will you be able to measure that?
Yeah, and also I have to tell you another factor to maintain 8-hydroxydeoxyguanosine low is only major difference is his asbestos is very low. So this two factor is very important. But asbestos is present in oncology. Nobody even think about asbestos because they cannot measure. Only measurement is since it's not water soluble, you have to cut the tissue and burn the tissue, and then burned remaining you wash with water, and then whatever left you put on the electron microscope and see if there is any crystal. So with that kind of the approach, there will be no progress. Yeah. So you can see why the research on the asbestos is practically no progress. Yeah.